and 79% N. Exhaled air contains 16% oxygen, 4% CO and 79% N. The total number of intercostal muscles are A. 7 pairs, B. 11 pairs, C. 24 pairs, D. 12 pairs. Correct answer. The intercostal muscles are a group of intrinsic rib cage muscles that occupy the 11 intercostal spaces. The intercostal muscles consist of 11 muscle trios in humans. In humans, the muscles are solely for the purpose of expanding and contracting the rib cage. In human body, pituitary gland is situated in A. Kidney, B. Neck, C. Abdomen, D. Brain. Correct answer. The pituitary gland is small and oval-shaped. It is located behind your nose, near the underside of your brain. It is attached to the hypothalamus by a stalk-like structure. Total number of chambers in the human heart is A. 3, B. 2, C. 1, D. 4. Correct answer. The human heart is divided into 4 chambers, namely 2 ventricles and 2 atria. The ventricles are the chambers that pump blood and atrium are the chambers that receive the blood. Among which, the right atrium and ventricle make up the right portion of the heart, and the left atrium and ventricle make up the left portion of the heart. Powerhouse of the cell is A. Mitochondria, B. Nucleus, C. Golgi bodies, D. Ribosomes. Correct answer. Sinoatrial nodes is located in which part of the heart? A. Left atrium, B. Right atrium, C. Right ventricle, D. Left ventricle. Correct answer. The sinoatrial node, SAW node, is located in the right atrium of the heart. The SAW node is the pacemaker of the heart, and it is responsible for generating the electrical impulses that cause the heart to beat. The SAW node is made up of specialized cardiac muscle cells that have the ability to spontaneously depolarize, which means that they can generate an electrical impulse without any outside stimulation. The number of thoracic vertebrae is A. 7, B. 6, C. 9, D. 12. Correct answer. The thoracic spine is located in the upper and middle part of the back. 12 vertebrae are located in the thoracic spine and are numbered T1 to T12. Each number corresponds with the nerves in that section of the spinal cord. T1 through T5 nerves affect muscles, upper chest, mid-back and abdominal muscles. Transformation of one type of cells into another type is called A. Anaphase, B. Dysphase, C. Metaplasia, D. Hyperplasia. Correct answer. Metaplasia is the irreversible conversion of one differentiated cell or tissue type into another. Metaplasia usually occurs in tissues that undergo regeneration, and may, in a pathological context, predispose to an increased risk of disease. Number of lumbar vertebrae are A. 7, B. 6, C. 10, D. 5. Correct answer. The lumbar spine contains 5 vertebrae, labeled L1 to L5, which progressively increase in size going down the lower back. The vertebrae are connected with joints at the back to enable bending and twisting movements of the spine. They protect the spinal cord and the cauda equina in the lower back by enclosing these tissues within a bony canal. Sacrum has A. 6 fused bones, B. 5 fused bones, C. 12 fused bones, D. 8 fused bones. Correct answer. The sacrum is made of 5 fused vertebrae configured as an inverted triangular bone that is concave anteriorly and convex posteriorly. Within the sacrum lies the sacral canal, which is a continuation of the vertebral canal. Which bones is also known as collar bone, beauty bone? A. Clavicle, B. Radius, C. Scapula, D. Humerus. Correct answer. The clavicle, or collarbone, is also referred to as beauty bone because of its prominent body location. It is the only long bone that lies horizontally in the body. The shape of the clavicle appears elongated, due to its unique anterior and posterior curvatures. Bone of upper jaw is A. Maxilla, B. Mandible, C. Ethmoid, D. Nasal bones. Correct answer. The maxilla is the bone that forms the upper jaw. It is a paired bone, meaning that there are two maxillae, one on each side of the face. The maxilla is a complex bone that has many functions. It supports the upper teeth, forms the roof of the mouth, and helps to form the nose and cheeks. The maxilla is also involved in chewing, swallowing, and speech. Only movable bone of skull is A. Ethmoid, B. Mandible, C. Maxilla, D. Nasal bones. Correct answer. Skull is formed of 22 bones. Mandible or jaw bone is the only movable bone of the skull, forming the temporomandibular joint with the temporal bone. The suture that joint the front and parietal bones is A. Lambdoidal, B. Coronal, C. Sagittal, D. Frontal. Correct answer. The coronal suture is a fibrous joint that joins the frontal and parietal bones of the skull. It is located at the top of the skull, running from ear to ear. The coronal suture is a synarthrosis, which means that it is a fixed joint that does not move. The suture that joint the parietal bone with occipital bone is A. Lambdoidal, B. Coronal, C. Sagittal, D. Frontal. Correct answer. Posterior aspect of the skull sagittal suture, between two parietal bones lambdoid suture, between the parietal bone and occipital bone lambda, convergence of the sagittal and lambdoid suture resembles to a Greek letter, lambda. The bone that forms back of the head is A. Temporal, B. Sphenoid, C. Parietal, D. Occiput. Correct answer. Bone consists of A. Water, B. Calcium phosphate, C. Osteoid, D. All. Correct answer. Bones are made up of a framework of a protein called collagen, with a mineral called calcium phosphate that makes the framework hard and strong. Bones store calcium and release some into the bloodstream when it's needed by other parts of the body. Osteoid is the unmineralized, organic portion of the bone matrix that forms prior to the maturation of bone tissue. Sternum is A. Flat bone, B. Irregular bone, C. Long bone, D. Sesamoid. Correct answer. The sternum is a partially T-shaped flat bone that forms the anterior portion of the chest wall centrally. Example of flat bones are except A. Sternum, B. Ribs, C. Most skull bones, D. Vertebrae. Correct answer. Vertebrae are not considered flat bones. They are irregular bones that form the vertebral column or the backbone, which provides support and protection for the spinal cord. Length of male urethra is approximately is A. 30–40 centimeters, B. 18 to 20 cm, C. 10–12 centimeters, D. 2 to 4 cm. No. Correct answer is B. The male urethra measures, on average, 18 to 20 cm in length. It commences at the internal urethral orifice in the trigone of the bladder and opens in the navicular fossa of the glans penis at the external urethral meatus, which is the narrowest part of the urethra. At the tip of penis, triangular structure is known as A. Glans penis, B. Prepuce, C. Urethra, D. Sperm. Correct answer. Glans penis is the rounded head at the tip of the penis, and it is indeed shaped like a triangle when uncircumcised. It is the most sensitive part of the penis and contains numerous nerve endings. Just above the glans skin fold, which from a movable double layer, is known as A. Urethra, B. Prepuce, C. Glans penis, D. Sperm. Correct answer. The prepuce, also known as the foreskin, is a retractable double layer of skin and mucous membrane that covers the glans penis. It is present in most mammals, including humans, and is thought to protect the glans from injury and infection. The prepuce is also thought to play a role in sexual function, as it contains a large number of nerve endings. Bone-forming cell are known as A. Osteoclasts, B. Osteoblasts, C. Osteocytes, D. All. No. Correct answer is B. Osteoblasts are large cells responsible for the synthesis and mineralization of bone, i.e., the formation of bone, whereas fibroblasts synthesizes the extracellular matrix and collagen. Chondroblasts will form chondrocytes in the growing cartilage matrix, and chondroclasts are mature osteoclasts which are capable of cartilage matrix reabsorption. Bone-destroying cell are A. Osteoclasts, B. Osteoblasts, C. Osteocytes, D. All. Correct answer. Destruction, or resorption, of bone by large cells called osteoclasts releases calcium into the bloodstream to meet the body's metabolic needs and simultaneously. Weight of non-pregnant uterus is A. 1,000 grams, B. 10 grams, C. 100 grams, D. 50 grams. No. Correct answer is D. The size of a non-pregnant uterus in an adult is about length, width, and thickness. A. 12.5 x 10 x 2.5 centimeters. Correct answer. The uterus is a hollow, pear-shaped organ with thick muscular walls in the young nulliparous adult. The shape is like piriform, pear-shaped. Position: anteversion, lean forward, and antflexion, bent forward. Size 7.55 2.5 centimeters. Weigh is 50 to 60 gm. Non-pregnant. At which temperature successful spermatogenesis take place? A. At normal body temperature. B. 10 above normal body temperature. C. 3 below normal body temperature. D. 3 above normal body temperature. No. Correct answer is circa. It needs a temperature around 2 to 3 degrees Celsius lower than the normal body temperature, i.e., around 35 degrees Celsius. The part of sperm which contain its DNA. A. Tail, B. Legs, C. Body, D. Head. Correct answer. The head of the sperm contains the DNA, which when combined with the egg's DNA, will create a new individual. The tip of the sperm head is the portion called the acrosome, which enables the sperm to penetrate the egg. Age of puberty in females is approximately A. 13 years, B. 16 years, C. 25 years. Correct answer. The age of puberty in females can vary, but it typically occurs between the ages of 9 and 14 years. However, it's important to note that individual variations exist, and some girls may experience puberty earlier or later than this average range. In which phase of menstrual cycle ovulation occurs? A. Alimentary phase. B. Menstrual phase. C. Proliferative phase. D. Secretory phase. No. Correct answer is circa. The first phase of the menstrual cycle is the follicular or proliferative phase. It occurs from day 1 to day 14 of the menstrual cycle, based on the average duration of 28 days. During days 10 to 14 of the cycle, only one of the developing follicles forms a fully mature egg. Around day 14 in the menstrual cycle, a sudden surge in LH causes the ovary to release this egg. Menopause means A. Ovulation. B. Starting of M.C. C. Cessation of M.C. D. Meeting of sperm. Correct answer. The cessation of menstrual cycles at the end of a woman's reproductive period is termed menopause. The hormone which is responsible for maturation of the follicles is A. LH. B. FSH. C. Progesterone. D. Thyroxine. No. Correct answer is B. The hormone that's responsible for the maturation of follicles is follicle-stimulating hormone FSH. FSH is produced by the pituitary gland and causes the development of follicles, which are fluid collections that grow around eggs. FSH also causes estrogen levels to rise. Formation of corpus luteum takes place under the influence of A. LH. B. Estrogen. C. FSH. D. Progesterone. Correct answer. Ovulation is triggered by a surge of luteinizing hormone LH from the anterior pituitary, which occurs a few hours before ovulation. After ovulation, the follicle lining cells develop into the corpus luteum, yellow body, under the influence of LH from the anterior pituitary. The corpus luteum produces the hormone progesterone and some estrogen. Function of HCG hormone. A. Secretion of FSH. B. It stimulates the corpus luteum to continue secrete progesterone and estrogen. C. Secretion of LH. D. Induction of ovulation. Correct answer. Human chorionic gonadotropin is a hormone produced primarily by syncytiotrophoblastic cells of the placenta during pregnancy. The hormone stimulates the corpus luteum to produce progesterone to maintain the pregnancy. Smaller amounts of HCG are also produced in the pituitary gland, the liver, and the colon. The pH of vagina is between A. 3.85.0. B. 2 to 6. Correct answer. The normal vaginal pH ranges between 3.8 and 5.0, which is moderately acidic. The wall of the uterus are except A. Perimetrium. B. Myometrium. C. Endometrium. D. Endocardium. Correct answer. The endocardium is not a part of the uterine wall, it is the inner lining of the heart. Diaphragm is A. Bone. B. Body cavity. C. Blood vessels. D. Muscles. Correct answer. The diaphragm, located below the lungs, is the major muscle of respiration. It is a large, dome-shaped muscle that contracts rhythmically and continually, and most of the time, involuntarily. Upon inhalation, the diaphragm contracts and flattens and the chest cavity enlarges. Enzyme heparin and histamine are secreted by A. Mast cells. B. Leukocytes. C. Fat cells. D. RBCs. Correct answer. Mast cells are a type of white blood cell that are found in the connective tissue throughout the body. They are responsible for releasing histamine and heparin, which are chemicals that play a role in the immune response. Pinna of the ear is formed by A. Bones. B. Hyaline cartilages. C. Elastic cartilages. D. Lymphoid tissues. No. Correct answer is circa. The medical term for the outer ear is the auricle or pinna. The outer ear is made up of cartilage and skin. There are 3 different parts to the outer ear: the tragus, helix and the lobule. Antibodies are A. Substances produced against antigen. B. Disease-producing agents. C. The air, the type of bacteria. D. Substances produced by pathogens. Correct answer. Antibodies, also known as immunoglobulins, are proteins produced by the immune system in response to the presence of foreign substances called antigens. Antigens can include various pathogens such as bacteria, viruses, fungi, and parasites, as well as non-infectious substances like toxins and allergens. Antigens are A. Substances that destroy antibody. B. Substances that stimulate production of antibody. C. Substance that provide immunity. D. Substance which are used for sterilization. Correct answer. The immune system protects the body from possibly harmful substances by recognizing and responding to antigens. Antigens are substances, usually proteins, on the surface of cells, viruses, fungi, or bacteria. Non-living substances such as toxins, chemicals, drugs, and foreign particles such as a splinter can also be antigens. The immune system recognizes and destroys, or tries to destroy, substances that contain antigens. Phagocytosis is mainly done by A. RBC. B. WBC. C. Platelets. D. Nephrons. Correct answer. Phagocytosis, the process of engulfing and digesting foreign particles or microorganisms, is primarily performed by certain types of white blood cells WBCs called phagocytes. These include neutrophils, monocytes, and macrophages. Cell mainly involved in immunity are A. RBCs. B. Renal cells. C. Platelets. D. Lymphocytes. Correct answer. Lymphocytes are a type of white blood cell that are responsible for the body's immune response. They are produced in the bone marrow and then mature in the thymus gland or the spleen. Once they are mature, lymphocytes circulate in the blood and lymph nodes. When lymphocytes encounter a foreign invader, such as a virus or bacteria, they become activated and release a variety of chemicals that help to destroy the invader. Cell-mediated immunity is provided by A. Both T and B lymphocytes. B. B lymphocytes. C. T lymphocytes. D. RBCs. Correct answer. Cell-mediated immunity is an immune response that involves the activation of T cells rather than antibodies. These helper T cells activate a chemical messenger called cytokines, which produce cytokines T cells that bind and kill the infected cells. Antibody-mediated immunity is provided by A. T lymphocytes. B. B lymphocytes. C. Both T and B lymphocytes. D. RBCs. Correct answer. Antibody-mediated immunity is primarily provided by B lymphocytes B cells. These cells are a type of white blood cell that plays a crucial role in the humoral immune response. When B cells encounter foreign substances known as antigens, they can differentiate into plasma cells, which are responsible for producing antibodies. The pH of saliva is A. 7, B. 7, C. 7, D. Correct answer. Saliva has a pH normal range of 6.2–7.6 with 6.7 being the average pH. Resting pH of mouth does not fall below 6.3. In the oral cavity, the pH is maintained. Thymus gland lies in A. Abdominal cavity. B. Pelvic cavity. C. In the upper parts of mediastinum. D. Brain. Correct answer. The location of your thymus gland is in your upper chest behind your breastbone, sternum. It sits between your lungs in a part of your chest called the mediastinum. Your thymus is just in front of and above your heart. Pear, S patch are found in A. Stomach. B. Kidney. C. Liver. D. Small intestine. No. Correct answer is D. Peyer's patches are groupings of lymphoid follicles in the mucous membrane that lines your small intestine. Lymphoid follicles are small organs in your lymphatic system that are similar to lymph nodes. Peyer's patches are located in your small intestine, usually in the ileum area. The ileum is the last portion of your small intestine. In addition to further digesting the food you eat, the ileum also absorbs water and nutrients from food. Hemoglobin contains A. Only proteins, B. Only iron, C. Protein and calcium, D. Both proteins and iron. Correct answer. Place where RBCs are produced is A. Liver, B. Red bone marrow, C. Blood, D. Testes. Correct answer. Red blood cells RBCs are produced in the red bone marrow, which is found in the flat bones of the body, such as the hips, breastbone, and skull. The red bone marrow is made up of stem cells, which are cells that can turn into any type of cell in the body. When the body needs more RBCs, the stem cells in the red bone marrow turn into RBCs. Lifespan of RBC is about A. 10 days, B. 12 days, C. 19 days, D. 120 days. Correct answer. The normal time of RBC senescent age-related death in adults is approximately 110 to 120 days. Hemolysis can therefore be arbitrarily defined as a shortening in the survival of circulating RBCs to a value of less than 100 days. Total amount of blood in human body is A. 7-8% of body weight, B. 4-5% of body weight, C. 12-13% of body weight, D. 22. No. Correct answer is A. The blood vessels which connect the artery and veins. A. Sinus, B. Arterioles, C. Venules, D. Capillary. Correct answer. Capillaries are the smallest and most numerous blood vessels in the body. They connect the arteries and veins, allowing for the exchange of oxygen, nutrients, and waste products between the blood and surrounding tissues. The only artery which supplies deoxygenated blood. A. Pulmonary artery, B. Gastric artery, C. Hepatic artery, D. Renal artery. Correct answer. In following which is both exocrine and endocrine gland. A. Pituitary gland, B. Adrenal gland, C. Pancreas, D. Thyroid gland. Correct answer. The pancreas serves as an exocrine gland by secreting digestive enzymes into the digestive tract and as an endocrine gland by producing hormones such as insulin and glucagon that regulate blood sugar levels. In following which structure is also known as pacemaker of heart. A. SAW node, B. AV node, C. Correct answer. The SAW node is a specialized group of cells located in the right atrium of the heart. It generates electrical impulses that initiate the heartbeat and set the pace for the heart's rhythm. These electrical signals from the SAW node spread throughout the atria, causing them to contract and pump blood into the ventricles. The function of fallopian tube is A. Secretion of estrogen and progesterone, B. Correct answer. The fallopian tubes, also known as uterine tubes, oviducts, or salpinges, are muscular, hollow organs that are part of the female reproductive system. Their main function is to transport eggs from the ovaries to the uterus. These are passageways for an egg and a sperm to meet and for a fertilized egg embryo to make its way to the uterus. Ovulation is defined as A. Reputter of Graafian follicles, B. Maturation of Graafian follicles, C. Seepage of blood through vagina, D. Facilitate their maturation during Correct answer. The smallest form of vein is known as A. Venules, B. Vein, C. Vena cava, D. Sinus. Correct answer. The smallest vein is known as the venules. The smallest cardiac vein is called the Thunbesian veins, which is present in the wall of the heart and drains the myocardium. Vaginal canal normally has A. An acid environment, B. An alkaline environment, C. A neutral environment, D. An environmental difficult to determine. Correct answer. The vaginal canal normally has a moderately acidic environment, with a normal pH between 3.8 and 5.0. A pH of less than 7 is considered acidic, 7 is neutral, and more than 7 is basic. Total number of muscles in human body are A. 200, B. 300, C. 650, D. 400. Correct answer. It's estimated that there are over 650 named skeletal muscles in your body. Other muscle tissue, such as smooth muscle, typically occurs on a cellular level, meaning that you can actually have billions of smooth muscle cells. The muscles of your body perform a variety of vital functions. Blood groups were first discovered by A. Karl Landsteiner, B. Robert Koch, C. Paul Ehrlich, D. Anton von Leeuwenhoek. No, correct answer is A. The ABO blood group system is widely credited to have been discovered by the Austrian scientist Karl Landsteiner, who identified the O, A, and B blood types in 1900. Normal platelet count in human being is A. 25000-50000, B. 50000-10000, C. 10000-40000, D. 40000-60000. No, correct answer is circa. The normal platelet count in a human being is C 100,000-400,000 platelets per microliter of blood. Platelets are small cell fragments that are crucial for blood clotting and preventing excessive bleeding. Haversian canal are found is A. Lung, B. Bone, C. Brain, D. Kidney. No, correct answer is B. Haversian canals, sometimes canals of Havers, are a series of microscopic tubes in the outermost region of bone called cortical bone. Out of the following, which hormone is secreted by the posterior pituitary gland? A. Growth hormone, B. Prolactin, C. ACTH, D. ADH. Correct answer. The full form of ADH is an antidiuretic hormone. ADH is secreted from the hypothalamus and it is released from the posterior pituitary gland. This hormone controls the osmolarity inside the body system and regulates the water level in the body through reabsorption or secretion of water during the formation of urine. Functions of stomach are except A. Temporary storage of food, B. Digestion of food, C. Absorption of food, D. Production of intrinsic factor. Correct answer. Bile and pancreatic juice are secreted in A. Duodenum, B. Stomach, C. Ileum, D. Jejunum. Correct answer. Bile and pancreatic juice are secreted in the duodenum. The duodenum is the first part of the small intestine, shaped like a C. Pepsin is responsible for the digestion of A. Fat, B. Protein, C. Carbohydrate, D. Mineral. No, correct answer is B. The enzyme pepsin plays an important role in the digestion of proteins by breaking down the intact protein to peptides. Bile is A. Basic, B. Acidic, C. Neutral. No, Correct answer is A. Bile is alkaline or basic in nature. It helps in neutralizing the acidic chyme that enters the small intestine from the stomach and creates a suitable environment for the enzymes to act upon the food particles. Amount of bile secreted daily is A. 500 milliliters. B. 501. Correct answer. Bile is helpful in A. Emulsification of fat. B. Digestion of fat. C. Correct answer. Bile salts help in the emulsification of fats, i.e. breaking down the large fat droplets into very small micelles. Villi are responsible for A. Digestion of food. B. Metabolism of food. C. Increasing surface area of small intestine. D. Forward movement of food. Correct answer. The pH of intestinal juice is A. Acid. B. Basic. C. Neutral. D. None of these. Correct answer. Intestinal juice typically has a slightly basic pH due to the presence of bicarbonate ions, which help neutralize the acidic chyme coming from the stomach. Pancreatic juice consists of enzymes except A. Lipase. B. Trypsin. C. Amylase. D. Pepsin. Correct answer. Pancreatic juice is a liquid secreted by the pancreas, one which contains a number of digestive enzymes, including trypsinogen, chymotrypsinogen, elastase, carboxypeptidase. The end product of digestion of protein is A. Fatty acid. B. Glucose. C. Minerals. D. Amino acid. Correct answer. The amount of gastric juice secreted daily. A. 1.5 lit. B. 3 lit. C. 0.5 lit. D. 2.5 lit. Vaginal canal normally has A. An acid. Correct answer. The vaginal canal normally has a moderately acidic environment, with a normal pH between 3.8 and 5.0. A pH of less than 7 is considered acidic, 7 is neutral, and more than 7 is basic. Total number of muscles in human body are A. 200, B. 300, C. 650, D. 400. Correct answer. It's estimated that there are over 650 named skeletal muscles in your body. Other muscle tissue, such as smooth muscle, typically occurs on a cellular level, meaning that you can actually have billions of smooth muscle cells. The muscles of your body perform a variety of vital functions. Blood groups were first discovered by A. Karl Landsteiner. B. Robert. Correct answer. The ABO blood group system is widely credited to have been discovered by the Austrian scientist Karl Landsteiner, who identified the O, A, and B blood types in 1900. Normal platelet count in human being is A. 25000-50000, B. 50000-10000, C. 10000-40000, D. 400,000, 600,000. Correct answer. The normal platelet count in a human being is C100,000 400,000 platelets per microliter of blood. Platelets are small cell fragments that are crucial for blood clotting and preventing excessive bleeding. Haversian canal are found is A. Lung, B. Bone, C. Brain, D. Kidney. Correct answer. Haversian canals, sometimes canals of Havers, are a series of microscopic tubes in the outermost region of bone called cortical bone. Out of the following, which hormone is secreted by the posterior pituitary gland? A. Growth hormone, B. Prolactin, C. ACTH, D. ADH. Correct answer. The full form of ADH is an antidiuretic hormone. ADH is secreted from the hypothalamus and it is released from the posterior pituitary gland. This hormone controls the osmolarity inside the body system and regulates the water level in the body through reabsorption or secretion of water during the formation of urine. Functions of stomach are except A. Temporary storage of food, B. Digestion of food, C. Absorption of food, D. Production of intrinsic factor. Correct answer. Bile and pancreatic juice are secreted in A. Duodenum, B. Stomach, C. Ileum, D. Jejunum. Correct answer. Bile and pancreatic juice are secreted in the duodenum. The duodenum is the first part of the small intestine, shaped like a C. Pepsin is responsible for the digestion of A. Fat, B. Protein, C. Carbohydrate, D. Mineral. Correct answer. The enzyme pepsin plays an important role in the digestion of proteins by breaking down the intact protein to peptides. Bile is A. Basic, B. Acidic, C. Neutral, D. Has no pH. Correct answer. Bile is alkaline or basic in nature. It helps in neutralizing the acidic chyme that enters the small intestine from the stomach and creates a suitable environment for the enzymes to act upon the food particles. Amount of bile secreted daily is A. 500 milliliters, B. 500 1000 ml, C. 1000 ml, D. Correct answer. Bile is helpful in A. Emulsification of fat, B. Digestion of fat, C. Digestion of protein, D. Emulsifaction of glucose. Correct answer. Bile salts help in the emulsification of fats, i.e. breaking down the large fat droplets into very small micelles. Villi are responsible for A. Digestion of food, B. Metabolism of food, C. Increasing surface area of small intestine, D. Forward movement of food. Correct answer. The pH of intestinal juice is A. Acid, B. Basic, C. Neutral, D. None of these. Correct answer. Intestinal juice typically has a slightly basic pH due to the presence of bicarbonate ions, which help neutralize the acidic chyme coming from the stomach. Pancreatic juice consists of enzymes except A. Lipase, B. Trypsin, C. Amylase, D. Pepsin. Correct answer. Pancreatic juice is a liquid secreted by the pancreas, one which contains a number of digestive enzymes, including trypsinogen, chymotrypsinogen, elastase, carboxypeptidase, pancreatic lipase, nucleases and amylase. The end product of digestion of protein is A. Fatty acid, B. Glucose, C. Minerals, D. Amino acid. Correct answer. The amount of gastric juice secreted daily. A. 1.5 lit. B. 3 lit. C. 0.5 lit. D. No. Correct answer is A. The gastric mucosa secretes 1.2 to 1.5 liters of gastric juice per day. Gastric juice renders food particles soluble, initiates digestion particularly of proteins, and converts the gastric contents to a semi-liquid mass called chyme, thus preparing it for further digestion in the small intestine. Gastric juice consists of except A. HCl, B. pepsin, C. trypsin, D. intrinsic factor. Correct answer. The average amount of saliva secreted daily in human is approximately A. 1 lit, B. 2 lit, C. 0.5 lit, D. 1.5 lit. No. Correct answer is D. No of temporary teeth are A. 20, B. 10, C. Correct answer. Children have just 20 teeth, called primary, temporary, or milk teeth. They include the same 10 teeth in the upper and lower jaw, 4 incisors, 2 canines. At which age temporary teeth start to erupt in children? A. 1 year, B. 1.5 year, C. 3 month, D. 6 month. No. Correct answer is D. Largest taste buds are A. Filiform, B. Fungiform, C. Valate, D. No. Correct answer. Blood supply to intestine is done by A. Superior mesenteric artery, B. Coeliac artery, C. Inferior mesenteric artery, D. All of the above. Correct answer. Total No of salivary glands in human are A. 1 pair, B. 2 pairs, C. 3 pairs, D. Correct answer. Human major salivary glands consist of 3 pairs of glands known as parotid, submandibular, and sublingual glands. Together they are responsible for 90% of the total saliva. Accessory organs of the digestive systems are except A. Liver, B. Pancreas, C. Salivary glands, D. Prostate glands. Correct answer. The accessory organs of the digestive system include the liver, pancreas, and salivary glands. The liver plays a vital role in digestion by producing bile, which helps in the breakdown and absorption of fats. It also stores nutrients, detoxifies harmful substances, and produces important proteins involved in blood clotting. The pancreas produces digestive enzymes that help break down carbohydrates, proteins, and fats in the small intestine. It also produces insulin and glucagon, hormones that regulate blood sugar levels. In an adult, weight of kidney is about A. 300 gm, B. 50 gm, C. 500 gm, D. 140 gm. No. Correct answer is D. Each kidney is approximately 3 cm cm thick, 6 cm wide, and 12 cm long. In males, the average weight of the kidneys is roughly 129 grams g for the right one and 137 grams for the left. In females, the average weight of these organs is 108 grams for the right kidney and 116 grams for the left kidney. Which is the most common cation in ECF? A. Na. B. K. C. Ca. D. Mg. Correct answer. The most abundant cation, or positively charged ion, in the extracellular fluid, ECF, is sodium, Na. The most abundant anion, or negatively charged ion, in the ECF is chloride, Cl. The most abundant cation in the intracellular fluid, ICF, is potassium, K. In following which is the most cation in ICF? A. Na. B. K. C. Ca. D. Mg. Correct answer. Potassium is absorbed as potassium ion from the soil by the plant. It is most abundant cation in the intracellular fluid and maintains anion-cation balance in cells. It is involved in protein synthesis. It helps in opening and closing of stomata. It also helps in maintaining turgidity of the cells. The artery which supply blood to kidney is A. Coeliac, B. Cystic, C. Renal, D. Common iliac. Correct answer. The functional unit of kidney is A. Nephrons, B. Medulla, C. Calyxes, D. Hilum. Correct answer. Each of your kidneys is made up of about 1 million filtering units called nephrons. Each nephron includes a filter, called the glomerulus, and a tubule. The nephrons work through a two-step process. The glomerulus filters your blood, and the tubule returns needed substances to your blood and removes wastes. The pH of urine is A. 3.5, B. 6.8, C. 7.4. No. Correct answer is B. The pH of urine is a measure of how acidic or alkaline it is. The pH scale ranges from 0 to 14, with 7 being neutral. A pH below 7 is acidic, and a pH above. Which is the largest vein in the body? A. Superior vena cava. B. Femoral vein. C. Inferior vein cava. D. Cerebral vein. No. Correct answer is circa. The inferior vena cava carries blood from the legs, feet, and organs in the abdomen and pelvis. The vena cava is the largest vein in the body. Diameter of blood capillaries are about A. 15 micrometers, B. 7 micrometers, C. 1 micrometer, D. 20 micrometers. Correct answer. Capillary is a small blood vessel from 5 to 10 micrometers μm in diameter. Capillaries are the smallest blood vessels in the body. In an adult, normal value or BP is A. 140/100ths of a millimeter per hectogram, B. 120/80ths of a millimeter per hectogram, C. 150/106ths of a millimeter per hectogram, D. None of them. Correct answer. Location of SAW node in the heart is A. In the wall of left atrium, B. In the wall of right ventricle, C. In the wall of left ventricle, D. In the wall of right atrium. Correct answer. The sinoatrial SAW node, also known as the sinus node, is located in the upper right atrium of the heart. It's a small, crescent-shaped cluster of specialized cells that generates electrical impulses to initiate each heartbeat. Total period of one cardiac cycle is A. 0.8 seconds, B. 0.5 seconds, C. 2 seconds, D. 1.5 seconds. Correct answer. In cardiac cycle, duration of atrial systole, ventricular systole and complete cardiac diastole are respectively A. 0.3 seconds, 0.4 seconds and 0.1 seconds. B. 0.3 seconds, 0.1 seconds and 0.4 seconds. C. 0.1 seconds, 0.3 seconds and 0.4 seconds. D. No. Correct answer is circa. Atrial systole continues for about 0.1 seconds. Ventricular systole continues for about 0.3 seconds. Atrial diastole continues for about 0.7 seconds. Ventricular diastole. ECG is used for the examination of A. Heart, B. Kidney, C. Brain, D. Liver. Correct answer. Mediastinum means A. Space between the kidney, B. Space between the lungs, C. Space between the eyeballs, D. Space between the heart and diaphragm. Correct answer. Hypothalamus is found in A. Cerebellum, B. Mid-brain, C. Cerebrum, D. Midbrain. No. Correct answer is circa. It is a small region located below the thalamus and above the brainstem, making up part of the diencephalon within the midbrain. Total volume of CSF secreted in 24 hours is A. 500 milliliters, B. 1200 ml, C. 850. No. Correct answer is A. The total volume of CSF is 150 milliliters for the average adult, where 125 milliliters is confined to the subarachnoid spaces and 25 milliliters to the ventricles. CSF is renewed 4 or 5 times over a 24-hour period, and the total volume of CSF produced is roughly 580 milliliters per day. CSF found in A. Epidural space, B. Subdural space, C. Subarachnoid space, D. All. No. Correct answer is circa. Cerebrospinal fluid, CSF, is a clear, colorless, watery fluid that flows in and around your brain and spinal cord. Your brain and spinal cord make up your central nervous system. It controls and coordinates everything you do, including your ability to move, breathe. When a person is sitting, the CSF pressure is about A. 10 cm HO, B. 30 cm HO, C. 10 mm H0, D. 30 mm H0. No. Correct answer is B. CSF pressure, as measured by lumbar puncture, is 10 to 18 cm/HO, 8-15 mm of mercury or 1.1-2 kilopascals, with the patient lying on the side, and 20 to 30 cm/HO, 16-24 mm of mercury or 2.1-3.2 kilopascals, with the patient sitting up. If a person is moving from a lying position to a sitting position, then what effect will be seen on CSF pressure? A. It will increases. B. No. Correct answer is A. Temperature regulating center of the body is A. Medulla oblongata, B. Thalamus, C. Hypothalamus, D. Pituitary gland. Correct answer. Normal pH for arterial blood is A. 7.42, B. 7, C. 7.3, D. 7.5. No. Correct answer is A. The pH is in the normal range, 7.35-7.45. Use a pH of 7.40 as a cutoff point. In other words, a pH of 7.37 would be categorized as acidosis, and a pH of 7.42 would be categorized as alkalemia. Which of the following is related to vision testing? A. Acetic acid, B. Litmus paper, C. Tuning fork, D. Snellen, S. Correct answer. A Snellen chart is an eye chart that can be used to measure visual acuity. Snellen charts are named after the Dutch ophthalmologist Herman Snellen, who developed the chart in 1862. When plasma enters the tissue, it is called A. Blood, B. Lymph, C. Capillary fluid, D. Interstitial fluid. Correct answer. Interstitial fluid is the fluid that surrounds the cells in tissues. It comes from blood plasma and plays a crucial role in the exchange of nutrients and waste products between the blood and the cells. The transportation system of blood is A. Cardiovascular system, B. Urinary system, C. Endocrine system, D. Integumentary system. Correct answer. Addison's disease is caused by insufficiency of hormone. A. Thyroid hormone, B. Parathyroid hormone, C. Corticosteroid hormone, D. Insulin. Correct answer. Addison's disease is a rare but serious adrenal gland disorder in which the body can't produce enough of two critical hormones, cortisol and aldosterone. Patients with Addison's will need hormone replacement therapy for life. An artery that supplies blood to the head and neck. A. Carotid artery, B. Coronary artery, C. Mesenteric artery, D. Intercostal artery. Correct answer. Your carotid arteries are blood vessels that supply blood to your brain, face, and neck. in the stomach. D. Food reached in the rectum. No. Correct answer is B. Chyme or chymus is the semi-fluid mass of partly digested food that is expelled by a person's stomach, through the pyloric valve, into the duodenum chyme. Skull consists of A. 14 bones, B. 12 bones, C. 22 bones, D. 13 bones. No. Correct answer is circa. The skull consists of 22 bones. These bones are divided into two groups, the cranial bones and the facial bones. The cranial bones protect the brain, while the facial bones support the muscles and tissues of the face. Longest bones human body is A. Humerus, B. Femur, C. Tibia, D. Fibula. Correct answer. The hormone controlling the use of glucose by the cell is A. Steroids, B. Growth hormone, C. Insulin, D. Thyroxine. Correct answer. The hormone that controls the use of glucose by cells is insulin. Insulin is produced by the pancreas and plays a crucial role in regulating blood sugar levels. It allows cells to take in glucose from the bloodstream and use it as a source of energy or store it for later use. Insulin helps maintain normal blood glucose levels by promoting glucose uptake by cells and inhibiting the production of glucose by the liver. T cell is mature in A. Liver, B. Thymus, C. Spleen, D. Kidney. No. Correct answer is B. The thymus is a specialized organ where T cells develop and mature before they are released into the bloodstream to perform their immune functions. O-positive blood group not available in blood bank. Which blood may be given to patient? A. A positive, B. A flat positive, C. O negative, D. B positive. Correct answer. Type O positive blood is critical in trauma care. Those with O positive blood can only receive transfusions from O positive or O negative blood types. Type O positive blood is one of the first to run out during a shortage due to its high demand. Which enzymes immediately present after attack of myocardial infarction? A. CPKMB, B. Troponin, C. Erythropoietin, D. Antenatal. Correct answer. The proteins are released into the circulation between 3 and 4 hours after myocardial infarction and remain detectable for 10 days following. There are a number. Hair color in human turn white due to absence of which of the following pigments? A. Bilirubin, B. Biliverdin, C. Melanin, D. Melatonin. Correct answer. Melanin is the pigment responsible for determining hair color. When melanin production decreases or stops entirely, typically due to aging or other factors, hair can turn white or gray. Therefore, the absence or reduction of melanin is what causes hair to lose its color and appear white. During swallowing, food is stopped from entering the larynx by the A. Pharynx, B. Esophagus, C. Eustachian tube, D. Epiglottis. Correct answer. Epiglottis is a tiny flap of cartilaginous tissue attached to the entrance of the larynx, and covers it during swallowing, to prevent the entry of food into the air tract. Which is the following is an example of tissue? A. Brain, B. Liver, C. Stomach, D. Blood. Correct answer. Through which of the following organs maximum nutrition elements in the food are absorbed in? A. Mouth, B. Large intestine, C. Small intestine, D. Abdomen. Correct answer. The small intestine, which is also known as the small bowel, is an organ within the alimentary canal, in which most of the end absorption of minerals and nutrients from food takes place. The bile produced through A. Stomach, B. Pancreas, C. Liver, D. Receptor. Correct answer. Bile is a greenish-yellow fluid that is produced by the liver. It plays a crucial role in the digestion and absorption of fats in the small intestine. Pernicious anemia is caused by a deficiency of A. Iron, B. Vitamin B12, C. Thiamine, D. Folic acid. Correct answer. Pernicious anemia is a rare autoimmune disorder that occurs when the body can't absorb vitamin B12. The body needs vitamin B12 to produce red blood cells. Wilms tumor is tumor of A. Brain, B. Testes, C. Kidney, D. Liver. Correct answer. Wilms tumor, also known as nephroblastoma, is a tumor of the kidneys. An individual whose blood type is B may in emergency donate blood to a person whose blood type is A, B or A, B, A or O, C, A, B or A, D, A, B or B. Correct answer. Light rays entering the eye is controlled by A. Iris, B. Pupil, C. Cornea, D. Lens. Correct answer. The pupil is responsible for controlling the amount of light that enters the eye. It is the dark, circular opening located in the center of the iris, which is the colored part of the eye. Main product of protein metabolism is A. Glycogen, B. Iodine, C. Carbohydrate, D. Amino acids. Correct answer. Protein metabolism entails the creation of proteins and amino acids, known as anabolism, as well as the breakdown of proteins into amino acids, known as catabolism. The blood plasma contains A. 80% of water, B. 95% 0F water, C. 90% of water, D. 60% of water. Correct answer. Which portion of the heart receives oxygenated blood? A. Left auricle, B. Right auricle, C. Left ventricle, D. Right ventricle. Correct answer. The left auricle, also known as the left atrium, receives oxygenated blood from the lungs via the pulmonary. For assessing range of joint movement, the nurse will ask the patient to move away from the body, evaluating the movement of A. Flexion, B. Abduction, C. Extension, D. Adduction. Correct answer. When assessing the range of joint movement, the nurse may ask the patient to perform various movements to evaluate different types of joint mobility. If the nurse instructs the patient to move away from the body, the nurse is likely assessing abduction, which is the movement of a body part away from the midline of the body. ATP does not form in A. Glycolysis, B. TCA cycle, C. Fatty acid oxidation, D. hemp pathway. No. Correct answer is D. ATP, adenosine triphosphate, is primarily generated in glycolysis, the tricarboxylic acid TCA cycle, and oxidative phosphorylation electron transport chain. The pancreas produces which two hormones? A. Insulin and glucagon, B. Epinephrine and insulin, C. Melatonin and glucagon, D. Glycogen and epinephrine. Correct answer. The pancreas produces insulin and glucagon, two hormones that regulate blood glucose levels. These hormones are released into the blood by clusters of endocrine cells in the pancreas called the islets of Langerhans. AED stand for A. Arrhythmia eliminating device, B. Authorized emergency defibrillator, C. Advanced emergency defibrillator, D. Automated external defibrillator. Correct answer. Fluid balance is regulated by A. Lungs, B. Heart, C. Kidney, D. Brain. Correct answer. Electrolyte balance is regulated by A. Heart, B. Kidney, C. Liver, D. Brain. Correct answer. Electrolyte balance refers to the regulation of electrolyte concentrations, such as sodium, not potassium, K, calcium, Ca2, and chloride, Cl, in the body fluids. What is asphyxia? A. Decreased O and difficult in breathing, B. Increase O and slow breathing, C. Slow breathing, D. O increase and irregular breathing. Correct answer. Asphyxia or asphyxiation is a condition of the deficient supply of oxygen to the body which arises from abnormal breathing. ECG change in myocardial infarction is A. Wide ORS complex. B. Present of U waves. C. Prolonged PR interval. D. ST segment elevation. Correct answer. Which of the following is an indicator of AIDS? A. CD4 count lower than 200 cells M3. B. CD4 count more than 400 cells M3. C. CD4 count. D. CD4 count lower than 1000 cells M3. Correct answer. The normal mean pulmonary artery pressure is A. 10 to 15 mHg. B. 15 to 20 mHg. C. 20 to 25 mHg. D. 25 to 30 mHg. No. Correct answer is A. The normal mean pulmonary artery pressure is 10 to 15 mHg because the pulmonary circulation has lower resistance compared to the systemic circulation. This lower pressure allows for efficient oxygenation of blood in the lungs. The normal intraocular pressure is A. 10 to 21 mHg. B. 8 to 21 mmHg. C. 20 to 35 mmHg. D. 19 to 38 mmHg. Correct answer. Normal intraocular pressure is 10 to 21 mmHg. Bleeding time is prolonged in all the following except A. Hemophilia A. B. Idiopathic thrombocytopenia. C. Viper bite. D. Von Willebrand disease. No. Correct answer is circa. Bleeding time is prolonged in all of the following except for viper bite. Viper bites are venomous bites that can cause a variety of symptoms, including bleeding. However, the bleeding from a viper bite is not typically prolonged. Which blood group universal recipient? A, B, AB, C, B, D, O. Correct answer. What is the action of parathormone in human body? A. Increase blood Na level. B. Decrease blood Na level. C. Increase blood Ca level. D. Decrease blood Ca level. Correct answer. Parathyroid hormone PTH, also known as parathormone, is a hormone produced by the parathyroid glands in the human body. Its primary action is to increase blood calcium levels through various mechanisms. Which enzyme is help in fat digestion? A. Lipase. B. Trypsin. C. Pepsin. D. Amylase. Correct answer. pH of blood. A. 7.35 minus 7.45. B. 6.8 minus 7.12. C. 7.45 minus 7.85. D. 7.25 minus 8. Correct answer. A structure composed of two or more tissue is A. Serous membrane. B. Complex tissue. C. Organ system. D. Organ. Correct answer. An organ is a structure that is composed of two or more tissue types. Each organ performs one or more specific physiological functions. For example, the heart is an organ that pumps blood throughout the body. The stomach is an organ that digests food. The skin is an organ that protects the body from the environment. The basic unit of life is A. The atom. B. Water. C. The cell. D. The chemical level of organization. Correct answer. Which of the following is not the function of the liver? A. The breakdown of cholesterol. B. Storage of glucose. C. Detoxification of drugs. D. Production of bile. No. Correct answer is A. The liver performs a variety of functions such as synthesis, storage, and secretion of various substances. The liver secretes bile juice. It plays a key role in carbohydrate metabolism, in lipid metabolism. Bilirubin is formed from A. Globin, B. Heme, C. Gastroferritin, D. Transferrin. No. Correct answer is B. Bilirubin, Br, Latin for red bile, is a red-orange compound that occurs in the normal catabolic pathway that breaks down heme invertebrates. The smallest bone of human body is A. Stapes, B. Phalanges, C. Metacarpals, D. Xiphisternum. Correct answer. The stapes or stirrup is a bone in the middle ear of humans and other animals which is involved in the conduction of sound vibrations to the inner ear. The only artery which supplies deoxygenated blood. A. Gastric artery, B. Hepatic artery, C. Renal artery, D. Pulmonary artery. Correct answer. The pulmonary artery is the only artery that carries deoxygenated blood. It transports blood from the right ventricle of the heart to the lungs for oxygenation. Fault in male that may cause infertility includes A. Mumps or chitis, B. Raised scrotal temperature, C. Undescended testes, D. All. Correct answer. Sickle cell anemia is A. Allosomic hereditary disease, B. Autosomal hereditary disease, C. Epistatic effect, D. Nutritional disorder. Correct answer. Father of genetics is A. Muller, B. Darwin, C. Mendel, D. Bateson. No. Correct answer is Circa. Hemoglobin formation needs both A. Iron and zinc, B. Iron and copper, C. Iron and calcium, D. Iron and magnesium. No. Correct answer is B. Hemoglobin is a protein found in red blood cells that is responsible for carrying oxygen from the lungs to the body's tissues. It consists of 4 subunits, each containing a heme group. The heme group contains an iron atom, which is essential for the binding and transport of oxygen. Which cranial nerve has the highest number of branches? A. Facial nerve, B. Trigeminal nerve, C. Vagus nerve, D. None of these. No. Correct answer is Circa. The vagus nerve is the 10th cranial nerve and it has the highest number of branches. It is a mixed nerve that contains both sensory and motor fibers. Gallows traction is used for A. Fracture humerus, B. Avulsion fracture, C. Fracture tibia, D. Fracture neck of femur. Correct answer. Gallows traction is primarily used for fractures of the femur, thigh bone, and occasionally for fractures of the tibia, shin bone. Sex chromosomes are also called A. Allosomes, B. Heterosomes, C. Autosomes, D. Euchromosomes. No. Correct answer is A. Sex chromosomes are also called allosomes. Allosomes are a specific type of chromosome that determines an individual's sex in many species, including humans. In humans, the sex chromosomes are represented as X and Y chromosomes. Males typically have one X and one Y chromosome, XY, while females have two X chromosomes, XX. A failure in lymphatic system to return body fluids adequately result is A. Swelling of face and hands, B. Edema in spleen, C. Swelling of hands and legs, D. Swelling of tissue as edema. No. Correct answer is B. Acid-base balance is regulated by kidney by excreting hydrogen ion and electrolytes to maintain the A. Electrolyte balance in body, B. Specific gravity of urine, C. Filter the protein from urine, D. Normal pH of blood plasma. No, correct answer is D. One of the function of cerebellum is to A. Conduct nerve impulse. B. Serve as a passage between spinal cord and brain. C. Maintain balance, coordination and muscular control. D. Maintain area of reason, thought, memory and sensation. Correct answer. The cerebellum is a part of the hindbrain, also known as the rhombencephalon. Its functions include controls of balance, coordination, and fine muscle control, e.g., walking. It also functions to maintain posture and equilibrium. Which of the following is master? Hypothalamus. Correct answer. The respiratory center is located in the part of brain. A. Midbrain. B. Cerebellum. C. Thalamus. D. Medulla. No, correct answer is D. The thickest human skin is A. Palm. B. Neck. C. Sole. D. Head. No, correct answer is circa. Which one of the following organs breaks fat to produce cholesterol? A. Lungs. B. Liver. C. Kidney. D. Intestine. Correct answer. White blood cell act. A. As a defense against infection. B. As source of energy. C. For clotting blood. D. As a medium for oxygen transport from lungs to tissue. Correct answer. White blood cells are part of the body's immune system. They help the body fight infection and other diseases. Types of white blood cells are granulocytes, neutrophils, eosinophiles, and basophils, monocytes, and lymphocytes, T cells and B cells. The fibrous tissue connecting bone to bone is called A. Tendon. B. Ligament. C. Muscle. D. Cartilage. Correct answer. The fibrous tissue that connects bones to other bones is called a ligament. Ligaments are very elastic and have considerable strength. They are fibrous connective tissue that attach bones to bones, and usually serve to hold structures together and keep them stable. Most of the infection spread to the ear from throat through A. Ear canal. B. Cochlea. C. Eustachian tube. D. Tympanic membrane. Correct answer. Maturation defect in RBC is seen in A. Folic acid and B deficiency. B. Vitamin C deficiency. C. Vitamin D deficiency. D. Essential amino acid deficiency. Correct answer. Two strands of DNA are held together by which of the following? A. Covalent bonds. B. Electrostatic force. C. Hydrogen bonds. D. Van der Waals' force. No, correct answer is circa. Two strands of DNA are held together by hydrogen bonds. In which organ does the maximum absorption of iron take place? A. Stomach. B. Liver. C. Small intestine. D. Colon. No, correct answer is circa. The portion of the small intestine called the duodenum is the chief area where iron absorption takes place. There may be a second minor absorption site near the end of the small intestinal tract. Once iron is absorbed, it is transported by a protein called transferrin. Which ion not given is impaired renal function? A. Calcium. B. Sodium. C. magnesium, D. Potassium. Correct answer. Impaired renal function is associated with an increased risk of hyperkalemia, or high potassium levels in the blood. This is because the kidneys are responsible for excreting potassium, and when they are not working correctly, potassium can build up in the blood. High potassium levels can be dangerous and can lead to heart problems, muscle weakness, and even death. In diabetic ketoacidosis, which electrolytic replace? A. Na. B. K. C. Calcium. D. Magnesium. Correct answer. Significant hypokalemia is the most common life-threatening electrolyte derangement that occurs during the treatment of DKA. Intravenous potassium replacement will be required after insulin is given, as potassium will move into cells. Bile salt accumulation causes A. Psoriasis, B. Pruritus, C. Ecchymosis, D. Itching. Correct answer. Bile salt accumulation causes pruritus, which is a severe itching sensation that can be intense and unrelenting. The itching is often worse at night and can interfere with sleep. It can also cause scratching, which can lead to skin damage and infection. The rate of drug absorption is greatest in the A. Stomach, B. Gallbladder, C. Large intestine, D. Small intestine. Correct answer. The small intestine is the site of the greatest absorption capacity for most drugs due to its large surface area, the presence of both active and passive absorption mechanisms, and neutral pH. The small intestine is about 20 feet long and has a surface area of about 2,700 square feet. This large surface area is due to the presence of villi and microvilli, which are small, finger-like projections that increase the surface area of the small intestine. A decreased bone density called A. Joint stiffness, B. Osteomyelitis, C. Osteoporosis, D. Arthritis. Correct answer. Which one of the following ions helps in blood clotting? A. K. B. Ca. C. Mn. D. Po4-2. Correct answer. Platelet aggregation and fibrin formation both require the proteolytic enzyme thrombin. Clotting also requires calcium ions, Ca2, which is why blood banks use a chelating agent to bind the calcium in donated blood so the blood will not clot in the bag, about a dozen other protein clotting factors. Which one of the following is called the powerhouse of the cell? A. Ribosome, B. Lysosome, C. Nucleus, D. Mitochondria. Correct answer. Mitochondria are often referred to as the powerhouse of the cell. They are membrane-bound organelles found in most eukaryotic cells and are responsible for generating most of the cell's supply of adenosine triphosphate, ATP, which is the molecule that provides energy for cellular processes. Identify the part of human stomach which connects joint with esophagus. A. Cardia, B. Body, C. Fundus, D. Pylorus. Correct answer. The cardia, or cardiac region, is the point where the esophagus connects to the stomach and through which food passes into the stomach. Located inferior to the diaphragm, above and to the left of the cardia, is the dome-shaped fundus. Below the fundus is the body, the main part of the stomach. The main function of kidney is to A. Elimination oxygen, B. Metabolism vitamins, C. Elimination carbon dioxide, D. Regulate fluid balance and removing waste. Correct answer. Insulin is not administered through oral route because A. It caused gut bleeding, B. It caused nausea and vomiting, C. It is destroyed by gut, D. None of these. Correct answer. Gut. Gastrointestinal tract disorders (GIT) problems is related to the issues that pop up in your gastrointestinal tract or GI or the GI tract. This GI tract includes all the organs that fall between mouth and anus, such as the esophagus, stomach, both large and small intestines, etc. Which artery supplies oxygenated blood to the stomach? A. Celiac artery. B. Carotid artery. C. Gastric artery. D. Cephalic artery. No. Correct answer is A. The celiac artery arises from the aorta a short distance below the diaphragm and almost immediately. Which artery supplies oxygenated blood to the stomach? A. Celiac artery. B. Carotid artery. C. Gastric artery. D. Cephalic artery. Which artery supplies? Normal pH of urine is A. 4.6-8. B. 3.5-5. C. 6.5-9. D. 4.6-6. No. Correct answer is A. Urine pH can vary depending on a variety of factors, including diet, medications, and health conditions, but it typically ranges from 4.6 to 8. Maturation defect in RBC is seen in A. Silidenitis. B. Sialadenopathy. C. Sialadenoma. D. Sialden. Correct answer. The mother has sickle cell disease. Father is normal. Chance of children having sickle cell disease and sickle cell trait respectively are A. 50 and 50%. B. 0 and 100%. C. 25 and 25%. D. 10 and 50%. No. Correct answer is B. When one parent has sickle cell disease SS genotype and the other parent is normal odd genotype, the chances for their children are as follows. Sickle cell disease SS genotype 0%, sickle cell trait S genotype 100%. The oxygen binding capacity of 1 gram of hemoglobin is A. 1.34 milliliters. B. 2.28 milliliters. C. 0.28 milliliters. D. 10 milliliters. No. Correct answer is A. From the molecular weight of Hb, one can calculate that 1 gram of Hb can combine with 1.39 milliliters of oxygen. Actually, some of the Hb normally in red blood cells cannot bind oxygen. It is either MetHB or HbCO, and the empirically determined oxygen binding capacity of hemoglobin (CHB) is 1.34 milliliters O per gram Hb. Which among these is known as bad cholesterol? A. Isosuprine. B. Triglycerides. C. LDL. D. HDL. Correct answer. Write the meaning of costo. A. Colon. B. Rib. C. Cartilage. D. Common bile duct. Correct answer. The meaning of costo is rib. It is a combining form used in medical terms, especially in anatomy and pathology. It comes from the Latin costa, meaning rib, side. Takayasu is disorder of A. Vein. B. Lymph node. C. Artery. D. Nerves. No. Correct answer is circa. Takayasu arteritis is a condition that causes inflammation of the main blood vessel that carries blood from the heart to the rest of the body, aorta, and its associated branched blood vessels. As a result of the inflammation, the blood vessel walls become thick and make it difficult for blood to flow. Projectile vomiting, which is non-bilious, is seen in A. Pyloric stenosis. B. Meningitis. C. Hiatal hernia. D. Gastroenteritis. Correct answer. Which cell organelle is first damaged in hypoxia? A. Nucleus. B. ribosome, C. Mitochondria, D. Golgi body. No. Correct answer is circa. During hypoxia, reactive oxygen species can be generated 3 due to electron release before transfer to complex IV. This leads to DNA damage 34, opening of the mitochondrial permeability transition port 20, 38, and release of apoptogenic proteins such as cytochrome circa. Thrombocytopenia stand for A. Normal platelet count, B. Increased platelet count, C. Reduced platelet count, D. Weakness of platelet aggregation. Correct answer. It refers to a condition where there is a lower than normal number of platelets in the blood, which can lead to bleeding and bruising. Cell with a horse, shoe-shaped nucleus and abundant cytoplasma in a peripheral blood smear. A. Monocyte, B. Neutrophil, C. Lymphocytes, D. Eosinophil. No. Correct answer is A. Monocytes are the largest of the leukocytes, and constitute about 5% of the WBC population in peripheral blood. In blood smears, their nuclei are typically indented, sometimes deeply so, with a kidney bean or bent horseshoe shape. Monocytes belong to the same functional population as tissue macrophages. The normal pH of body fluid is A. 9.1 to 9.6, B. 7.3 to 7.45, C. 4.4 to 5.4, D. 7 to 7.1. Correct answer. Thyroid is effective only in the presence of A. Calcium, B. Potassium, C. Iodine, D. Sodium chloride. Correct answer. Water is mostly absorbed from digestive tract in the A. Large intestine, B. Stomach, C. Small intestine, D. Esophagus. No. Correct answer is circa. The small intestine is the longest part of the digestive tract, measuring about 22 feet in adults. It is responsible for absorbing most of the nutrients from food, including water. The small intestine is lined with millions of tiny finger-like projections called villi. These villi increase the surface area of the small intestine, which helps to absorb more nutrients.
Hi, good people. I hope you are well. So, welcome to our challenge series where we will be doing a number of questions. And for starters, we are starting with anatomy and physiology. So, we'll do around 23 papers. Then, after that, we'll also do other things. So, we're just doing, we'll be doing this anatomy and physiology. We'll also do obstetric, gynecology. We'll also do other papers for medical, surgical, among other ones. So we'll just be trying to answer the questions, then we'll also be having a feedback mechanism. So if you have any other question, you can just post it down in the chat box and we'll try to answer. Thanks, let's start.
The percentage of O in inspired air is A. 78%, B. 21%, C. 16%, D. 52%.
So for this, we'll go with the 21%.
Correct answer. Breathed in air contains 21% oxygen, 0.04% carbon dioxide, and 79% nitrogen. Concentration of oxygen in expired exhaled air is about A. 0%, B. 21%, C. 16%, D. 4%.
So for this, ideally, they are just focusing on the exhaled. Inhaled, we've talked of 21. So once the body has already metabolized, you'll find you always use around 5%. So 21 less 5, we remain with 16%.
Correct answer. Inhaled air contains 21% oxygen, 0.04% CO and 79% N. Exhaled air contains 16% oxygen, 4% CO and 79% N. The total number of intercostal muscles are A. 7 pairs, B. 11 pairs, C. 24 pairs, D. 12 pairs.
So for the total number of intercostal muscles, we relate it to the number of ribs. So we have 12. So intercostals, they are always in between. Okay. So we'll go with 11 pairs.
Correct answer. Intercostal muscles are located between the ribs. Since there are 12 pairs of ribs, muscles are present only between adjacent ribs, which creates 11 intercostal spaces on each side. Therefore, the total number of intercostal muscle pairs is 11. In human body, pituitary gland is situated in A. Kidney, B. Neck, C. Abdomen, D. Brain.
We'll go with the brain.
Correct answer. The pituitary gland is small and oval-shaped. It is located behind your nose, near the underside of your brain. It is attached to the hypothalamus by a stalk-like structure. Total number of chambers in the human heart is A. 3, B. Correct answer. The human heart is divided into 4 chambers, namely 2 ventricles and 2 atria. The ventricles are the chambers that pump blood and atrium are the chambers that receive the blood. Among which, the right atrium and ventricle make up the right portion of the heart, and the left atrium and ventricle make up the left portion of the heart. Powerhouse of the cell is A. Mitochondria, B. Nucleus, C. Golgi bodies, D. Ribosomes. Correct answer.
So ideally for the question is just testing about the cell and its function. So let's talk of the mitochondria, which is always the powerhouse of the cell.
Sinoatrial nodes is located in which part of the heart? A. Left atrium, B. Right atrium, C. Right ventricle, D. Left ventricle.
So the question is taking us back to the electrical conductivity of the heart, how the heart ideally, how it pumps. So for the SA node, they're always the primary pacemaker. You ought to know about the automaticity. So it has an automaticity of 60 to 100. So yeah, 60 to 100 even. That's when we also get the normal heart rate. Okay. So for SA node, they're always located at the atrium. So we'll go with left atrium.
No, correct answer is B. The sinoatrial node, SAW node, is
Okay, so for this, we'll have to go with the right atrium, and the explanation that we are being given. At the talk of the SA node is located in the right atrium of the heart. The SA node is the pacemaker of the heart. We've talked of the primary pacemaker, and it's always responsible for generating the electrical impulses that causes the heart to beat, okay? And you ought also to know it's always made up of specialized cardiac muscle cells that have the ability to spontaneously depolarize. That's what we talk of homoticity. Then we always say it means that they can generate an electrical impulse without any outside stimulation.
The number of thoracic vertebrae is A. 7, B. 6, C. 9, D. 12.
At this point is where now where problems begin. Thoracic vertebrae. Let's go with 6, then C.
No, correct answer is D. The thoracic spine is located in the upper and middle part of the back. 12 vertebrae are located in the thoracic spine and are numbered T1 to T12. Each number corresponds with the nerves in that section of the spinal cord. T1 through T5 nerves affect muscles, upper chest, mid-back and abdominal muscles.
Okay, so we'll go with the number of thoracic vertebrae is always 12.
Transformation of one type of cells into another type is called A. Anaphase, B. Dysphase, C. Metaplasia, D. Hyperplasia.
Hyperplasia, it means they become more, okay? And they're asking about the transformation of one type of cell into another. Can you go with the metaplasia?
Correct answer. Metaplasia is the irreversible conversion of one differentiated cell or tissue type into another. Metaplasia usually occurs in tissues that undergo regeneration, and may, in a pathological context, predispose to an increased risk of disease.
Okay.
Number of lumbar vertebrae are A. 7, B. 6, C. 10, D. 5.
At this point we are learning, like for thoracic we've talked of 12. Lumbar we are not sure, let's go with 7.
No, correct answer is D. The lumbar spine contains 5 vertebrae, labeled L1 to L5, which progressively increase in size going down the lower back. The vertebrae are connected with joints at the back to enable bending and twisting movements of the spine. They protect the spinal cord and the cauda equina in the lower back by enclosing these tissues within a bony canal.
Okay, now we know of the number of lumbar vertebrae as being 5. Okay.
Sacrum has A. 6 fused bones, B. 5 fused bones, C. 12 fused bones, D. 8 fused bones.
Wow, another problem. Sacrum has. Can you go with 6?
No, correct answer is B. The sacrum is made of 5 fused vertebrae configured as an inverted triangular bone that is concave anteriorly and convex posteriorly. Within the sacrum lies the sacral canal, which is a continuation of the vertebral canal.
Okay. Oh, they are talking of the oh, sorry. My head was thinking other things. But the sacrum always has 5 fused vertebrae. Okay. Okay.
Which bones is also known as collarbone, beauty bone? A. Clavicle, B. Radius, C. Scapula, D. Humerus.
Now, when you talk of the collarbone, is always referred to as the beauty bone. If you try check humerus at the upper limbs, scapula is always behind, so it's not part of the beauty bone. Radius, it's also the limb, so you remain with clavicle.
Correct answer. The clavicle, or collarbone, is also referred to as beauty bone because of its prominent body location. It is the only long bone that lies horizontally in the body. The shape of the clavicle appears elongated, due to its unique anterior and posterior curvatures. Bone of upper jaw is A. Maxilla, B. Mandible, C. Ethmoid, D. Nasal bones.
Maxilla, then the mandible. Okay.
Correct answer. The maxilla is the bone that forms the upper jaw. It is a paired bone, meaning that there are 2 maxillae, one on each side of the face. The maxilla is a complex bone that has many functions. It supports the upper teeth, forms the roof of the mouth,